far-reaching, I think about necessary, and I think about innovative.
Improved newborn outcomes.
Educate, support, and motivate.
Dedicated to quality.
I think safety is the word that I'd like to use there.
Transformative, equitable, and positive.
So when I think about the work of MSPQC, it definitely has spread abroad in our state. And I think it's really remarkable what the group has done. It's so powerful to have a multidisciplinary network working for one cause, that one cause being to promote the best outcomes for the mothers of Mississippi as well as their neonate.
I think over the last 10 years, all of us have learned more about quality improvement, which most of us didn't come out of training knowing a whole lot about. And so I think over the past 10 years, as a state, we've got on the same page and improved on how we do quality improvement and hopefully improve outcomes.
MSPQC has impacted the healthcare of Mississippians and their babies in a positive way over the last decade. Through the introduction of the safety bundles, it has streamlined patient care. I can remember patient care before we implemented the bundles and now getting to see it after. It's a better process. We have systems in place through education, earlier recognition of signs and symptoms, routine processes such as hemorrhage risk assessments, doing QBLs, and boy, was that a mountain to climb, but we got through it and our patients are better because of it.
Blue Cross Blue Shield of Mississippi has collaborated with MSPQC since its inception. That collaborative relationship developed around a shared goal of improving maternal and infant health outcomes across Mississippi. In alignment with that goal, Blue Cross Blue Shield of Mississippi developed the maternity quality model. And that is an initiative that partners us with network hospital teams and providers across the state to improve maternity care by implementing best practice solutions. We have continued to work with MSPQC together around this shared goal of ensuring that every mom and every baby across Mississippi are receiving high quality and safe health care. MSPQC has been instrumental in elevating awareness statewide around opportunities to improve care for moms and babies. Events like the annual conference are a good example because at each conference, healthcare teams, community workers, and other organizations come together to focus on how we can continue to improve care across the state.
If it's been 10 years since the Quality Collaborative started, well, I've been manager here about 25 years, and it was tough because we were, as I said, an island down here in Brookhaven, and though we had great leadership with our obstetricians, the opportunity to network that Monica and Dr. Collier allowed us just made such a big difference in validating our practices that we were doing here at King's Daughters. It gave us that seat at the table that we never felt like we had. And so it was so nice when members of my group would go to the collaborative meetings and see that we were doing the right thing. And in some cases, we were doing better than a lot of people in those upper echelon facilities were doing. And so that, I think, was when it all started coming together. And we realized that we were all a team here in Mississippi, trying to do the right thing for our mothers and our babies.
So the Mississippi Perinatal Quality Collaborative, I believe, had a profound impact on the perinatal community in Mississippi. As you know, Mississippi has had some of the worst outcomes in infant mortality and maternal health for many decades. There have been concerted efforts across many organizations, university, health department, individual nonprofit organizations, all working hard, individual hospitals, providers working hard on trying to improve these outcomes. But it was difficult to get everybody on the same page and work together. And when Perinatal Quality Collaboratives started to form around the country in other states like California, Illinois, Florida, they were demonstrating positive changes. They were demonstrating improvements as they worked through creating statewide initiatives and working together instead of alone. And so that was an exciting thing to bring to Mississippi, and have the MSPQC really try to bring together the efforts across multiple sectors, across multiple organizations, and really lead change in the same direction across focused projects. So both in maternal and infant health, MSPQC was working to say, this is a non-competition space, let's share, let's teach each other, and let's give the resources hospitals and communities need to make improvements in maternal and infant health. So that was an exciting new endeavor for the state to take on, and a new approach to the way we did things. And we were excited to be one of the newer states to create its own PQC from scratch. Some other states had them for 15 and 20 years, and we jumped right in and tried to implement the same types of projects as states with much bigger resources and much more, many more people. But even though Mississippi was small, we had a pretty big impact in the first few years of forming in 2014.
I have so many, but if I could tie it down to one thing, I would say the teamwork and collaboration, just being able to be a part of this multidisciplinary network that is unifying for one goal. We have so many people from diverse backgrounds, diverse professional backgrounds. And it's wonderful to see how people can unify. Together, everyone achieves more, right? And so I really feel that really personifies what the MSPQC is trying to do. And that probably sums up my greatest memory or most rewarding experience with this group.
My favorite experience has been finding out more about our state. I think we all have a tendency to practice in our silos, and we hear about this happening over Meridian, we hear about this happening on the coast, we hear about this happening in Tupelo. And MSPQC has been great about bringing us all together and finding out more about our state and about the way people are practicing differently and the way people are practicing the same.
My favorite memory with working with MSPQC would have to be the iSupport project. I came on board about 5 years ago. This project was just being launched. We were chosen as one of 5 in the state to be a part of the pilot program. And I got to work with a great team, Dr. Collier, Janice Skaggs, one of the midwives. And every month, these webinars they put together were so informational. It just brought so many things to light, things that we could be doing. And their goal was to teach us to not leave any stone uncovered. And they did a great job in educating and engaging and motivating us to go back to our units and change the culture and have those difficult conversations in an effort to decrease our C-section rates and do the best thing for our patients. So that project became my passion. It still is. That was not a cut and dry kind of project. There were many different sides to it. We went back and tackled patient education and built that program up with prenatal education and educational flyers. We attempted to train our staff any way that we could, going to these workshops. And it's a project that we're still slowly moving towards and working on, but I'm thankful that we have had so much great support from MSPQC, and we've seen a lot of success.
It has been a pleasure to work with MSPQC throughout the years to help support teams in implementing safety bundles. These maternity safety bundles are best practice care checklists that specifically focus on obstetric conditions. And so ever since the first statewide go live of the very first safety bundle, obstetric hemorrhage and pregnancy, together with MSPQC, we have co-hosted small work group meetings across the state. With each region, hospital teams come together to focus on bundle best practices, but in addition, they're able to share successes with bundle implementation, in addition to how they've been able to overcome common barriers to progress.
I think my greatest memory of working with the MSPQC is, again, the camaraderie with the other hospitals and staff and nurses and being able to network. I see women now at other conferences that we go to that I met at the MSPQC 10 years ago. So I've got Susan Spencer's telephone number. I've reached out to her over the past 10 years and things to see how they're doing at Golden Triangle. It's just made us be more available to each other, more of a family. We all have that common goal of trying to make us be off the bottom in Mississippi. We want to be the best here. I think that the MSPQC started that initiative for us, and it made our playing field a little more level with other states and bringing quality to our state and providing maternal health. The MSPQC also allowed us to have the opportunity to get resources. We have a very small budget down here. And so peanut balls, while they may not be the most expensive things, that was just something else that I was going to have to buy. And I needed the Jada and the hemorrhage cart and other things. And so them allowing us to get those and the toolkits free of charge made a big impact on how we took care of our community. So that has been a godsend for us. Having those resources and having those people on the phone at our fingertips if we needed help with things and how we were supposed to start these toolkits and any information that they were ever able to help us with. Had Monica on speed dial too, to tell me what's everybody else doing? How are they making this work? That just helped us so much, and it gave us that groundwork to be able to start eliminating cesarean sections that were unnecessary. Those peanut balls have worked wonderfully well for us. Changing positions, just the teaching, things that we thought we were doing right and we weren't. So that's been a great resource for us in having all those things at our fingertips to have that were available for free.
So my greatest memory with working with the Perinatal Quality Collaborative was when we were launching it. The first project chosen for maternal and infant health was around severe maternal hypertension. And we had the honor of having Dr. Jim Martin, who was internationally renowned in preeclampsia research, be in Mississippi, and he was a professor at the university, and he jumped right in to be a leader in our state. He was beloved across the state and well known, and when we were just getting started and people were looking at the PQC like, what is this? Why are you coming in? What are you trying to do? His presence really made such an impact to add to the legitimacy of the organization and to get folks to accept it. And Dr. Martin hopped in a car and would drive all over the state to different hospitals, and we would go and meet with people, and he would be right there on the road. And so that was one of my most positive memories. He has since passed, so we certainly miss him and his impact, but that was such a special thing because, again, being a world-renowned expert, that's not something he had to do, but he was passionate about the potential to see the changes that we know work around reducing maternal infant health implemented across the state. And so he knew it wasn't enough to see it on paper or research it, but to really get it to the ground and to the people was something I think he valued. So that's something I really cherish in my heart because, since him being passed, I like to just dedicate this to his memory. But yeah, those memories of Dr. Martin were great. And then if I could also add the any of the simulation training going around the state, teaching quantified blood loss, making, fake blood, and working with Blue Cross Blue Shield, who was an amazing partner, who really jumped in and helped with implementing some of the training and simulations, and driving up the highway with simulation mannequins and creating these hemorrhage carts with toolboxes. And now at hospitals, you go in and they all have very well-established carts. That's just routine now, and it really wasn't 10 years ago. It was a new thing. We were buying tackle boxes and toolboxes from Home Depot and putting all the hemorrhage supplies inside and dropping them off at hospitals. And now it's great to go around and, as I work in other facilities, see that impact, see quantified blood loss become just something that's routine and folks don't remember not doing it. And it's really special to know that's something that the Perinatal Quality Collaborative started.
And back to all of the great MSPQC leadership, Monica knows I'm not afraid to call her and say, hey, I need a resource for this, or can I send one more nurse to this class? Can you please fit us in? She's always going to help me out. If she doesn't know the answer, she's going to direct me to the person that does. So thank you, Monica, for all your hard work.
I'm very happy to talk about Monica since she has truly been the lifeblood of the Perinatal Quality Collaborative. When it was in the beginning, it was a very small team, and she came over from working within asthma at the health department and really took to the ground running, the behind the scenes work, making every connection with hospitals, helping with supplies, and really throwing this conference that everyone's enjoying every year, making it a real premier event. That was always something that it was meant to be something people enjoyed, something people look forward to, places where connections were made. Monica was behind all of that. So she has truly been an incredible leader that maybe no one will recognize in some way, or don't know that she was behind so many of those things. I mean, it was my pleasure and honor to be director of the PQC for the years that I was there. But while she was there, she made the work happen. And so the goal and the dream of the PQC was to be the kind of organization that would survive any kind of ups and downs, really be a center to bring folks together and to bring resources together to grow the positive work in Mississippi and have that positive impact. And so I think she's been right at the center of that all along, and no matter what kind of changes have come, you know, she's weathered through it and is really due so much credit for the longevity of the program itself. And so thank you, Monica. You're amazing, and I hope others, you know, recognize her for that too. So I want to congratulate Mississippi Perinatal Quality Collaborative. I know for the state of Mississippi, where we don't always have the best reputation across the country when it comes to infant and maternal health outcomes. When it came to our PQC, when we go to those national meetings, there was always a real positive light around the work being done. So it's a thing I think all of our states should be proud of. It's a thing our state should be working to maintain so that it survives and continues to have a positive impact as we're all working to improve outcomes in our state. So thank you. Well, I will say, I think the best part of the PQC was really bringing out the leaders in each of the hospitals, seeing particularly the nurses. I have to shout out the nurses who would come to the monthly meetings, who would work on implementing the safety bundles across neonatal and maternal health. I can really say, watching that evolution of nurses becoming leaders across each of the different hospital facilities, collecting data, scheduling and completing the trainings that were required with AIM, and synergizing with the AIM work, the Alliance and Innovation in Maternal Health. So I want to just recognize how hard nurses work across the hospitals in our state, and are really have really been fundamental to making the PQC successful over these last 10 years.